meeting and post-legislative session update. I'm Ann Jones. I'm a retired registered nurse and vice chair of healthcare for all Minnesota. And thank you for signing in this evening and spending some time with us on this issue of health justice, health system reform. Our presenters this evening are on the screen. I will go over our agenda quickly and our first up, we will hear from Elena Hain, our newest board member. Dave Garibaldi is going to talk a little bit about our restructuring of our executive committee. We're going to hear a legislative summary from Don Pilkinen, our legislative committee chair, legislative and policy chair. Our guest speaker this evening is Alex Lawson, executive director of Social Security Works, who will talk to us about the view from Washington, D.C. We'll have a Q&A after. There'll be some time for question and answer after Alex makes his remarks. And then Rose is going to facilitate some discussion about how you can help us move the patient-centered care direct payment bill forward going into the next legislative session. I've got some announcements, and then we'll talk about fundraising a little bit. Okay. First, we would like to hear from Elena Hain. Welcome, Elena.
Sure, thank you. So yes, I am Elena Hain. I am the executive director at the Minnesota Nurses Association. I first got involved in this work. I feel a little naive saying this as I was thinking about what I was going to say tonight. But back in 2011 was when I even came to the realization that this could be an option for us in the United States. Single payer healthcare. I remember being at an M&A convention and hearing some of our nurses talk about it who are on our governmental affairs commission. And I just thought, I was amazed. I mean, I was just like, I didn't even know that this was a thing for us. And what can I do to support it? Because this is what we need. So that's when I started getting involved with M&A, and then slowly got involved more and more. When I was a member, so I'm a nurse, I worked at Children's in St. Paul, Minnesota, and then became staff at M&A in 2019. And then all along the way, I was able to have Rose Roach as one of my mentors. And when I became the executive director in 2024, then she really became a mentor for me. So she has been a great friend and a mentor. And then when she invited me to join you all on this committee, I was super excited because this really is important work that we're doing, and fighting corporate healthcare, right, is the backbone. So anyway, I'm not sure what else to say, but thank you very much for including me and in this committee, and I'm super excited. So just getting the swing of things of what it is that we're doing, but thank you.
Thanks, Elena. We're really happy to have you. Dave Garibaldi, our newest co-chair of Healthcare for All Minnesota, will talk a little bit about our organizational structure.
Yeah, thank you, Ann, and good evening, everyone. Welcome. I'm so glad to see you all here. And the HCAM has recently made a slight change to our board structure, moving from a single chair to two co-chairs. Rose Roach and I are now in those co-chair positions. As HCAM and our healthcare reform movement grows, our leaders are finding ever-increasing workloads. Rose and her excellent presentations and expertise are in high demand both locally and nationwide. She is also an excellent leader for this organization, and we wish to have her continue in that role as much as possible. So the idea was presented to have a co-chair position added, and I offered to assume that role and was honored to be elected to serve in this capacity. I'm still learning the ropes and my exact role, so your patience is much appreciated if you notice any differences. And as we close in on the halfway point of 2026, it seems like a good opportunity to reflect on how critical our actions will be during the last half of this year and the first half of 2027. Indeed, the effects of a rise in uncompensated care that almost closed HCMC will be greatly escalated in the coming months, thanks in part to the GOP's horrible budget bill, H.R. 1. Of course, the solution for HCMC was yet another Band-Aid applied to a system which continues to hemorrhage cash into the pockets of industry middlemen. The good news is that HCAM is ready for this moment, and we are as determined as ever to fight for enactment of the patient-centered care direct provider payment bill in 2027 and the ultimate solution, a universal single-payer system, whether in the Minnesota Health Plan or Medicare for All in the following year or two. Our inside-outside game is taking shape as we strategize with our legislative allies, Senator John Marty and Representative Tina Liebling, and continue educating other legislators and the public as to the merits of the PCC bill, Minnesota Health Plan, and Medicare for All. We must use this campaign season to extend our efforts to bring state and national candidates on board. We have plenty of exciting projects ahead of us, and I hope you will consider helping us out, whether by volunteering or donating to support this work. Finally, a comment on our guest tonight, Alex Lawson. I first heard Alex years ago on the Tom Hartman radio program, where he was so popular he became a substitute host for Tom when he was absent. He has a wealth of information on the successes of both Social Security and Medicare and what we need to do to sustain, improve, and expand these programs. I hope you enjoy listening to him and perhaps getting your questions answered. So with that, I'll turn it back over to Ann.
Thanks, Dave. Don Pilkinen will provide a legislative report, including a review of 2026 and a look ahead to 2027. So Don, go ahead.
Thank you, Ann. And Dave, thanks for mentioning the imperative for enacting the patient-centered care bill. Tonight's quarterly meeting is timely for reporting on increased activity for moving the patient care PCC bill forward, which is needed as the stepping stone, as Dave mentioned earlier, for the Minnesota Health Plan. As you may recall, the June 2025 legislative report that I delivered last year wasn't very positive, as it reviewed setbacks on the bills we supported for improving much needed segments of healthcare delivery, not improving healthcare delivery for all overall, but certain segments, such as undocumented adult immigrant care, medical debt relief, dental care, and allowance to switch back from Medicare Advantage plans to Medicare without penalty. However, these setbacks on these partial solutions to healthcare delivery, these setbacks were offset by the success of our first lobby day, March 10th, 2025, with constituent visits to legislators on the PCC bill to deprivatize medical assistance and Minnesota Care, followed by successful information meetings with legislators on the bill last summer and fall, which garnered support from 14. Now it's up to 15 representatives and 15 or 14 representatives, and from 5 senators now up to 6 senators, along with more pending meetings, which Kip Sullivan had with Senator Johnson the other day, and won her support for the PCC bill. The impetus for these legislators' meetings was the president's July 4 signing into law H.R. 1, the big ugly bill that will cut $2 billion annually from Minnesota Medicaid, and explaining at these meetings how the PCC bill will save an annual $1 billion to alleviate the cuts to medical assistance and Minnesota Care without raising taxes and reducing benefits and enrollments. Fast forward to Lobby Day, March 10th, 2026, where the PCC bill was presented by John Marty at the Senate Health Committee information hearing in the morning, followed in the afternoon by Governor Walz announcing his budget proposal for the state to transition from the 8 MCOs mismanaging Medicaid dollars for the programs to more efficient management by a single state administrative service organization. However, at the morning Senate hearing, to no one's surprise, opposition to the PCC bill was voiced by some committee members and representatives of the Council for Health Plans. Similar opposition was voiced again at the March 18 House Health Committee information hearing, where Tina Liebling presented the bill. Thanks to the leadership and policy expertise of Kip Sullivan and Buddy Robinson, they figured out a process for responding with evidence against the baseless arguments from the opponents at the March hearings. By studying the hearings videos, they assembled the misleading statements and categorized them into a master list, and with resources of evidence proceeded to draft some counter arguments, which is a work in progress that we reviewed at our April Legislative Policy Committee meeting. The master list was sent to John and Tina, followed by a request for a strategy meeting on using the list to prepare argumentation against PCC opponents. Meanwhile, at our May Legislative Policy Committee meeting, Buddy presented a counter-argument with evidence against the historic fallacy voiced by an opposing legislator at the March hearing that MCO contractors of medical assistance and Minnesota Care have had low overhead in managing these programs since their insertion in the 1990s. Buddy's presentation gave an example of the issues for which the PCC legislators need to be prepared to debate going into and during the 2027 session, which was discussed June 2nd at the requested meeting with John and Tina that was attended by Rose, Kip, Buddy, Dave, and myself. Some of the elements we discussed for preparing legislators for developing the preparation was or is a video training session, or will be a video training session for responding to false statements, a video on caregivers' testimonies on the current sorry condition of care coordination, and a white paper as a booklet, kind of like a Cliff Notes, structured with an executive summary and opposition talking points with counterpoints and supporting documentation. To boost the legislators, 50 organizations signed on to a letter asking them to support the PCC bill. The supporting organizations are numerous indivisible groups throughout the state, unions, and civic organizations. Last summer's information meetings on the PCC bill garnered, as I reported earlier, support from many legislators. Now we're on a strategy for preparing them and others to not only support the bill, but to carry it through the 2027 committee hearings by making factual opening statements for the bill and countering with evidence against the opposition's baseless and misleading arguments. We have the evidence on our side.
Thank you, Don. And we are at time, and I see that Alex is in the house, so I'm gonna take my slides down and let us introduce.
You okay, Anne, if I take it?
Yes.
All right. So I just want to say that I've been incredibly lucky to have known and worked with Alex over the past, I don't know, about a decade or so, I think. To me, personally, Alex is one of the greatest political minds of our time. He's also a brilliant strategic organizer, and he's a fearless agitator. If you've ever seen him go after congressional reps in the halls of Congress, you know what I'm talking about. He's just an all-around one of the smartest humans I've ever had the pleasure of knowing and working with. We're really, really lucky to be grabbing some time from his really very busy schedule. There just aren't words for me to describe how much I respect and love this guy. Get ready because you're about to be wowed. Minnesota Health Justice Warriors, please welcome the Executive Director of the Social Security Works, my friend, Alex Lawson. Alex, take it.
Hooray. Thanks, Rose. And I love you and you're the best. I don't know if I can live up to that introduction, but I will try. So yeah, I'm sitting here in Washington, D.C. It's a very silly place that I'm in. Unfortunately, that's me being really nice because what we're talking about is a place where, people make decisions like cutting $1 trillion out of Medicaid, knowing that it's going to kill tens of thousands of people a year, on top of the tens of thousands of people a year who already die in this country because they don't have insurance. And these Republicans who just cut $1 trillion out of Medicaid, they're doing it to give tax handouts to the richest people in the history of the world. People who we know are in the Epstein files. They're literally using the money that they've been given from stealing our healthcare and killing the most vulnerable in our society to buy golden yachts, to sail to a pedophile island. This is evil that we're talking about. So silly is my phrase that I use to describe how disconnected Washington, D.C. is from the realities of America. You have to be a sociopath, which some of them are, or a cog in a machine that is built on violence. So it's just doing their job. And we've seen this throughout history, that when you cut into systems of great cruelty, the greatest cruelty, what comes out is just people. And every day, people in this town will go to work every day for a Republican legislator fighting tooth and nail to pass legislation. They just do a thing called vote-a-rama where they stay up all night to ram something through. And it's a process. It's an arduous process. And they do this to do the most despicable things possible. This was to fund a mass Gestapo-like police force, right? That's what they're doing. The greatest concern right now of the Republicans is this ballroom, a UFC fight on the lawn of the White House. I mean, it's not insanity. I won't give it the I won't allow it to just be called crazy, because it's not. It's evil, and it's the world that we live in. And I'm saying this all to remind ourselves of our deep, deep sanity, our deep, deep commitment to justice and humanity, that we are on the right side of this so fully you can't even express it, but also the magnitude of what we're up against. So why don't we have single payer healthcare? Because politicians in Washington, D.C. work for billionaires, criminally evil billionaires, right? Republicans in Washington, D.C., and some corporate Democrats who pay homage to Wall Street and the billionaires and not the American people. Because obviously we could have not just healthcare for everyone in this country. That's clearly we can do that. We're the richest country in the history of the world. The United States is the richest country in the history of the world. Of course, we could all have healthcare. We could have the best healthcare in the world. We could be a shining example and leading what it is to create a healthcare system that delivers high quality healthcare for everyone who needs it. So it's never a question of cost. It's never a question of cost. The Social Security Trustees Report, which is actually the Social Security and Medicare Trustees Report, just came out 2 days ago, or yesterday. Time is a flat circle. Sorry, it's yesterday or 2 days ago. And what it showed is obvious to all of us who pay attention, is that the policies of Donald Trump have hurt the the financial situation of both Social Security, moving the baby boomer surplus, which we call the trust fund. It's just baby boomers pre-funding their retirement. It's moving that exhaustion date in a year, and hurting Medicare. And these are direct results of Republican policies. And then, and I'm sure everyone saw this, but Mike Johnson got caught red-handed. And it was a really great get, whoever recorded or found, and I wish I could give them. I saw it on Twitter first, so I don't know who broke it, but these guys, they sometimes accidentally tell the truth when they think they're speaking to an audience that's not going to get out to everybody else. But this is what they say: we're going to cut Social Security and Medicare next year. Don't worry, rich people. We're going to do what you want. We just have to wait until the elections, because we don't want the people to know exactly what we're going to do. So we're going to lie to their faces. We're going to tell them that we're on the side of Medicare. We're on the side of Social Security. We're on the side of the people, but they're not. And then they say after the election, they're going to cut Social Security and Medicare. And let me be super duper duper clear here. That's exactly what they are going to do. In the last 2 years of Donald Trump's presidency, right? That is the section where they will pass things like cutting Social Security and Medicare. And let me be clear why. The next trifecta, if the Democrats get a trifecta in 2028, that's going to be the setup that has to actually legislate on Social Security, because the baby boomer surplus is going to be exhausted in 2032. So they know that if they don't cut it now, then we're going to be able to expand it. We're going to just tax rich people, the ultra wealthy, on Social Security. We're just going to get them to pay the same rate into Social Security as all the rest of us, and then we can expand benefits for everybody. It's the exact same thing with healthcare, though, and the reason I'm doing it this way is because sometimes we spend so much time worrying about like the math arguments and stuff that we convince ourselves that those are what are like, oh, if we just got the math right, then no, it's not about the math. Of course, we can afford to expand Social Security. Of course, we can afford Medicare for all. It's just about political will. And the reason that there's not the political will is because the billionaires are driving the bus right now. So we have to change that. And along the way, we have to remember that Democrats are not, automatically going to do the right thing. I think everybody here knows that, but it is never going to be the politicians who lead. It's just not in their nature. They are followers by nature. They're not leaders. The people are leaders. Politicians are generally cowards by nature as well, right? They stick their finger in the air, see which way the wind is blowing, and then say that's what they're in favor of. They see what's happening and they say, look at that. You see that? I did that. It's the people who do everything, right? You look at the history of the New Deal, you look at Francis Perkins and FDR and Eleanor Roosevelt and a host of other New Dealers who, only nerds like me know many of their names. But they will recognize, and they talk about it often, that they're just standing on movements that have built before them, right? So, for example, if you look at the New Deal and you look at Eugene Debs and what he put forward when he ran for president, you'll see a lot of the same ideas. But Eugene Debs and the movements around him, they quote unquote lost. But really what they were doing was building and building. And that's what we're doing when it comes to Medicare for All. We're building and setting things up so that when there is a moment to act, we have everything in place. Because I will also say, we do have the math. We've done the math. The math on healthcare is super simple. Giving everyone guaranteed healthcare in the United States of America saves money. So the question of how are you going to pay for that is not a real question. The question is, what are you going to spend the money that you save on? And then we can argue about it, Maybe we cut in and give some higher education for free so that people don't leave with debt. Maybe we try to solve the primary care physician crisis that we're in, right? There's a host of things, but the question is, what are we going to spend the savings on? So we don't answer them when they say, how are you going to pay for it? No, what are we going to spend the savings on? We can't afford the current system. How are you going to pay for the current system, which is driving us into bankruptcy? Right? That's the question that we have to ask. The point is that the math isn't what's holding us back. It's the billionaires. The policy is actually the easy part. We like single payer healthcare. It's really robust. We've got like a good, we've done a lot of work on it. But the honest truth is you could look around the world and there are other systems of guaranteed healthcare. So like you could just pick, right? It's not that difficult. Every other advanced economy in the world has accomplished this, and we're the richest one. So of course we can do it. The only question is political will. And that is all based on political organizing. And it's these meetings that get us to where we're going. And I bring up some history of the New Deal because sometimes it feels like we are not getting anywhere. It feels like, we're not actually moving the agenda forward. And that's what the corporate interests, that's what the billionaires want to do. So I don't want to dwell too much on this right now, but I just will say one of the favorite tactics of the billionaires is to just say, oh, well, we all know that Medicare for All isn't going to happen. So let's negotiate against ourselves and get the Democrats to put forward, let's say a public option bill of some sort, right? And they say, oh yeah, well, I'm Nostradamus, so I'm going to just tell you that right now. And you're like, no, you're not. You're carrying water for the insurers, right? You're carrying, and we've seen this before. If there was a moment for this experiment, we already had it, right? We did it with Obamacare. We aimed for the public option and we didn't even get the public option, which anyone who negotiated anything will tell you that, right? Like that's what you get when you negotiate against yourself, bupkis. But they cut Medicare for All out. You remember? They said the table does not include Medicare for All voices. And the reason they did that is because then it was an argument between the insurers, just killing people for profit with glee, and then like the insurers killing people for profit with like some regulations around them. And I worked on the push for Obamacare, and I'm not going to throw it out, like I'm proud of the expansions to Medicaid, and it has saved people's lives, and there's really good stuff in there, and it was flawed. And we cannot do that again. We cannot allow ourselves to be fooled again that Medicare for all is somehow not possible. Medicare for all is literally the only solution to get us out of the wreckage that we're in, because healthcare was a disaster, a dumpster fire, killing tens of thousands of people a year. And those people are those who need healthcare the most, right? That's our system literally preys upon those who need healthcare the most. I know I don't need to tell this audience that much about how healthcare works, because you all know this, but let me just go through how it works in the, why it's sometimes hard, because I'm sure you've talked to people and they're like, well, I love my insurance. I don't know what your problem is with insurance. And if you have heard that, don't argue with them. I will just tell you, just simply ask them, have you used your insurance right now? Like, are you right? And if they say yes, generally, I don't think that they're being honest. But most of the time, what it is 90% of the people are not interacting with the medical system at any one time. So only 10% of the population is actually interacting with the medical system. So 90% of people think that their insurance is great because they're not asking it to do anything. The people on Medicare Advantage who are like, I love my Medicare Advantage. I get a gift card with it. And you're like, you love the gift card. You are going to hate getting denied care and dying. Like, the gift card is good. I'm not going to argue with you on that. I'm saying the getting denied care and dying is the bad part. Watching your loved one die because they're denied care. That's the part that I'm saying is the bad part. That maybe we can get the gift cards in traditional Medicare. I don't know. But that's how the lie works. You convince people that they've got something really good, and then when they go to use it, that's when they find out that they don't. And the people, and now the scariest part is with big data, which, they say is AI, but really it's machine learning, big data, these databases that they have about us, that they've been collecting all this information, just surveillance society that we live in. They feed it all into AI, and they can pretty accurately predict many of the people, and it'll just get better and better, and by that I mean worse and worse. It could be used for gain, right? It could be used for public health. Just remind ourselves of this at all points. The same thing that they will use to kill people, predicting who is likely to get sick, who is likely to need care. That's how they predict, right? So MS, cancer, right? They go through family histories, all of the lifestyle stuff, everything that they know. They predict who's going to need costly care, and they work to cut them off their rolls as quickly as possible. That's called lemon dropping, right? The other thing they do is they market aggressively to people who are not likely to get care, and that's called cherry picking. And so what they love to do is to get paid by people who will never need healthcare. And just pause for a second to think about what I said, that we literally have technology right now that is accurately predicting who is likely to need costly care. But instead of using that to do interventions to reduce the harms and mortality, to reduce morbidity and mortality, right? So the people who get sick and the people who die, instead of doing that, we're using this amazing technology, scary, but still amazing, to make billionaires more billions. I don't know. I would say that's how fucked up our system is. I don't know if it's an okay place to swear or not, but like, there's no other way to describe that evil. We could be doing so. It's not just the harm that is happening. It's the distance from that harm to how good we could be doing that we always need to keep in mind. So that's a lot, I know. But the fight is so important because there's all these little fights along the way, and they're all setting up these pieces. So, like, for example, one of the things that we know they try to do is they're trying to destroy traditional Medicare, right? So they're trying to destroy traditional Medicare, which is guaranteed health care for everyone. If you get sick, you get the care that you need, right? That's where there aren't delays, denials. They try to stick delays and denials in, and they try to move people to Medicare Advantage. I'm bouncing around a little bit because I've been running around today, but I'll send this study around because I do think it's useful for people to see this one. And it's heartbreaking. But the level of people who leave their Medicare Advantage plan in the end of life period, and it's usually family members moving their loved ones off in hospice times, is astronomical. It's like just like it's not happening, and then end of life, boom. And that is desperate seeking of a solution that they won't find. When you see that data, they actually won't be able to find somewhere where they go. But that's if you look at those numbers and you make it granular, each one of those individuals is someone who is facing end of life care and are being delayed and denied by their Medicare Advantage plan, so much so that in that moment, they're leaving their Medicare Advantage plan. It's a really sobering public health sort of piece of data. Doesn't get enough limelight. Mainly because the public health nerds were sort of inured to how evil the system is. And I think that it's voices like ours here that we need to take that data and be like, don't be okay with the evil that's happening. And when we do, we say, Donald Trump and Republicans, you tried to take the AI delays and denials that they're using in Medicare Advantage and in corporate healthcare and the employer-sponsored plans, and you tried to stick it into traditional Medicare using a thing called Wiser. But all it is just the same delays and denials by robots that they're using in corporate insurance. And activists, I'm sure many of you on the phone and across this country have banded together and said, hell no, we're not going to let you, put this into traditional Medicare. We don't need your stinking robots telling us when we need care. That's what my doctor does. That's what my caregiver does. And there's a lot of members of Congress, Democrats, who are leaning into this. I'd like to highlight what I think is the most important effort, but there's a lot of effort, so I don't want to diminish them. This is a do everything moment. But Senator Ron Wyden is the ranking member, the highest ranking Democrat. So if the Democrats take the Senate, he will be the chair of the Senate Finance Committee, which is the most powerful committee and would have the jurisdiction on this. And he led a discharge petition, which I'm not going to go through all of it, but I think everyone here remembers, like, in this broken setup that we have where it's very difficult to get anything done unless it kills poor people and helps billionaires. The discharge petition is the only way that we've been able to get anything done, like the Epstein files, right? Like Ro Khanna and Thomas Massie used the discharge petition. So this is that. It's coming from the Senate, though. So they needed to get 30 senators, and they did. They got 30 senators. Again, it's either yesterday or the day before. And now there is 60 days where they have to act. The Senate has to act. Now you can imagine that Thune is not chomping at the bit to let this go forward, because it will put a bunch of Republicans on record before an election where they're going to have to be like, oh yeah, I'm definitely in support of robots denying care. Billionaires building software to deny care to people who need it the most. Which is why we have to make sure that that's the story that's told, which is why we can't let it be like, hey, the discharge petition on Wiser is up and we need your support on Wiser, right? Like, we have to be careful to remember to explain to people who aren't us what we're talking about. Most people still do not know that Medicare and Medicare Advantage are different, right? They just know Medicare. So we want to talk about privatizing Medicare because everyone hates that. Even people on Medicare Advantage actually still hate privatizing Medicare. And you're like, you've accidentally bought into it. Your Medicare has been privatized. But just remember to meet people where they are. So everybody hates AI denials in Medicare. And that's how we have to talk about it all the time. AI denials, robot denials, for-profit denials of care. And we need to really make that vote on the Senate floor a referendum on that concept. Because if we don't show out there, it will actually look really bad for us. And I don't want to scare people, but there are forces within the Democratic Party looking at the political landscape saying, hey, it does look like the Democrats are going to take the gavels in the House, maybe even in the Senate. Donald Trump's not going to sign stuff into law, but this will be starting to put out the message and the building blocks for if the Democrats then can win in 28 and replace Donald Trump with a Democrat. And there are a lot of forces right now who are saying, oh, yeah, well, you know what, I think everybody knows you can't get Medicare for all. So I think that we should moderate. I'm going to switch over to Social Security. I know this is a Medicare, but I know that you all also care about all of the things. So let me just name to shame forces that we're talking. So Tom Suozzi, right now, when Donald Trump just showed that his policies stole a year off the life of Social Security's trust fund, he put forward a bill for a closed door commission to cut Social Security with Tom Cole, right? So he's like, yeah, this is what the American people are clamoring for, folks. Now, just remember that this is the same Tom Suozzi who thought it was a good idea to run for governor. He's like, I got a feeling. I don't remember what he got, but I think it was like 0.5%. I mean, and he wasn't even up against, it was ugly. It was ugly. He's not great at coming up with good ideas. You also remember he was the Democrat who was like, I'm voting for ICE. Gosh darn it, that's where the American people were. And then he just got walloped with the American people being like, no, we're not. And then he had to go on an apology tour. You remember that's the same Tom Suozzi. Bad idea, Tom. Well, he's got another bad idea. And it's this closed door commission to cut Social Security. So the thing is, those bad ideas are bought and paid for, right? They don't come. Tom Suozzi is not a stupid man. I've met him many times. He called me one time on my cell phone to ask me to stop being mean to him in the press. And I was like, I'm not going to, man. Like, it's just not going to happen. But you can call me and he knows what he's doing, right? So the forces within the Democratic Party that are saying, now's the time for moderation. What evidence do you have that this, and it's the same people who said that Mamdani could never win, and then that Mamdani's policies would bankrupt New York, and then that he'll never be able to deliver. And you're like, no, you're talking about you. You are the ones who can never deliver. You are talking about you. As sick as it is, the Republicans actually do deliver, right? It's just they deliver evil for their evil paymasters. Like, politicians can absolutely do what they set their minds to. And the ones who don't, that's what they're paid to deliver. Bupkis, status quo. We cannot allow, from the carnage that we're in now, to go to the status quo, to be like, you know what, we should just go back to where we were. Absolutely not. We're in a moment, and I am afraid it will get worse. All indications are it will get worse. I don't know why there's any sign that, right? I mean, I should turn off my messages. I'm getting reporter contacts right now, so I have to stay focused, Alex. My brain doesn't let me do that. Stay focused. What we're dealing with right now is corporations who are seeing and looking into the future, armies of lawyers saying, get the gotta turn that off. Get the Democrats to say that their policies going forward are going to be these quote unquote moderate ones, which they're not moderate at all. They're extreme. They're extremely anti the American people. The American people are really clear what they want. And we have to ensure that Democrats understand that if they do get the gavels, the only reason they will is because of the people. And the people are telling them exactly what we want. So it's not all going to come down to the wiser vote. It's not all going to come down to defining it as AI denials of care in Medicare, but it is an important step because we want to flex on our victories. Because right now in the House, there is a working group that is deciding what the Democratic healthcare vision for the future is from the House right now. And that working group is not clear where they're going to land. And that's a scary place for us to be. It's bananas because, you know, like if you look at the 28 candidates, you have, you know, pretty centristy, establishmenty governors who are saying guaranteed health care. You know, Pritzker is not, you know, Mamdani, but he's saying, yeah, I mean, that's where the 28 is. They know that Medicare for all is the only way out of $1 trillion in Medicaid cuts. You know, hospitals around this country closing. I've gone to 9 hospitals, I think. No, way more than that. I think I've been to 9 states with like whatever. In Montana alone, I went to 4. So, and there's hundreds of hospitals closing, community health centers closing, nursing homes closing. And it's starting now. Montana moved theirs up, and I know I should go to Q&A quickly, but just maybe I'll end with this fact so that everyone can take a look at why the future has to be Medicare for all. Remember that Social Security did not grow out of rosy times, right? It wasn't like everything was going gangbusters and then we were like, let's do Social Security. No, it was from the depths of the Great Depression, an economic collapse the world had never seen before caused by Wall Street billionaires. And out of that, we built Social Security, not to just address the acute crisis of the time, but it did, but also to prevent that crisis from happening again in the future, which as it has grown, it did. As the policies from there have grown or were in place, it did. It's not a coincidence that they took down Glass-Steagall, which was enacted then, and then like a couple years later, there was an economic collapse. You're like, yeah, you let them gamble with our money again, right? So the point I'm making is that the carnage that's coming is going to get worse because it's only accelerating. What we're seeing in Montana is because their governor, for unknown reasons, I mean, because he's evil or somebody paid him, he accelerated the implementation of the Medicaid cuts to July, so next month, right? Every other state is after November. Nebraska already enacted it, so they did it as well. So if you look in Nebraska and Montana, you're seeing basically a future of the entire country. And what that future is hospitals closing, especially rural hospitals, but not only rural hospitals. So out of that wreckage, and once a rural hospital is gone in this current system, it's gone forever. And it's the same thing as the deindustrialization that we went through in the 80s when they're like, don't worry, there'll be new jobs. It'll all come back. We're going to take your manufacturing jobs, but there's going to be all these. No, there's not. Drive through Youngstown. Put on Bruce Springsteen singing about Youngstown and drive through Youngstown right now in Ohio, and you will see what that devastation caused. Those jobs never came back. The city is kind of empty. It used to be enormous, and now it's not. And you see that devastation across the manufacturing, you know, what we call the Rust Belt. We, the American people, now call the Rust Belt. Do you know what we transitioned to after the manufacturing economy? Every state in this country used to, the biggest things that drove their economies were manufacturing. We used to build and buy things built in America. That's how we built this country. When we were like, let's build things over in another country. So, it's cheap. And so now we don't build things in this country and we buy things not built in this country. And you know what we transition to? Healthcare. The largest economic driver in every state right now is healthcare. We transitioned to a healthcare economy, and then we just cut $1 trillion out of that economy. Those hospitals that are closing in those rural areas are not only the place where you go if you break your arm or if you're giving birth or any of the other things that you go to a hospital for. They're also the largest employer in the county. They're not just where you go to use your insurance, they're the largest provider of insurance in the county. This is facts, this is data. And it's not just the hospital, it's all of the things around the hospital that service the hospital. All of that is gone. And once it's gone, it's never coming back. Just like those manufacturing jobs never came back. And then those parts of America will die. That's the devastation that's coming. So no, Mr. Swazi, we don't need a moderate, corporate-based, leave the insurers in charge of the bus that they drove off the cliff, remembering that they're the ones who pushed for the one big beautiful bill, right? They're the ones, their cash money is what got us to this carnage. So no, they're not driving the bus. In fact, they're not even allowed on the bus. The workers can come work, but the C-suite guys, they're off the bus. They're not invited. And remember that we will win. We will win. Out of adversity, solidarity grows. We will build the future that we know we can. We will all win, and the only losers are going to be less than 1,000 billionaires. And I'm willing to take that. That's fine with me. My heart won't bleed for those 1,000 billionaires. So just remember through this all that we will get there. And I know I spoke over, but I can take some questions, rapid fire or something.
I'll consult with our next presenter and see if we can
Yeah, no, let's give it like 5 minutes for Alex to take questions.
Okay.
Anybody got questions for Alex?
I see a bunch in the chat.
I think there's just comments for the most part in the chat. Okay. I don't see any actual questions in there. Right. Anybody? He's pretty clear.
I do have one, if I can. I Googled the Congressional Progressive Caucus to see if we still had one. Most of us do most of our work right here in the state on working toward a state-based, universal single payer system. But we all agree we need a Medicare for all national health plan. Totally agree. Is there a Congressional Progressive Caucus in your mind that functions that way? Medicare for all is one of their policy goals. Can we believe that?
Yes, I think you can. I think that Pramila Jayapal is just the stalwart champion of Medicare for all. Greg Kassar now runs the CPC, yes. But that was a handoff from Pramila. And what you're seeing is a transitionary period and an opposition period right now. But I can just tell you, like, back of the house, there's the bands getting back together and the tables that are pushing progressive voting block stuff, the things that Pramila set up. I believe that, you can never trust a politician, literally any of them, even your faves, you can't trust them. So we have to make sure. And the state-based single payer stuff is what I think is going to make it crystal clear that we're going to, right? I mean, I don't know if it'll be the Saskatchewan model, but I do know that the states, like a state like Minnesota, which is like, well, we don't want our people to just die. Right? There are states in the old Confederacy that are like, hell yeah. I mean, Nebraska literally accelerated it. But for a state like Minnesota, when the hospitals close, the nursing homes close, the community health centers close, and people start dying, it'll become even clearer that the only way forward is a state single payer system. And, I'm not discounting Minnesota in any way, but you get California to do that. And already you've got, the economic power and the risk pool that any other state could tie into. Minnesota is big. your risk pool is robust. Minnesota is not Vermont. Washington, D.C., with our no senators, have more people living here than in Vermont, right? So I do think it's important to remember about size of risk pool. Minnesota's way big enough, but California is enormous. And so it's very easy for me to see the policies advancing far enough. This is called the push-pull stuff, right? This is the labs. It doesn't have to get all the way across the finish line. It's just sort of if it's inevitable. And I think we're seeing that with Gavin Newsom. So is the CPC real? Yes. Can we count on them on Medicare for All? Yes. Do we have to hold even our progressive allies accountable? Extra yes. Because if they jump ship, the flag that'll raise is a white flag of surrender, right? So we cannot allow our progressive champions to move away. And I just lost a hand, but I was just stopping this talk there. If you still had that question.
Linda, did you have a question? Linda's from the Minnesota Farmers Union.
Yep. Thank you, Alex, for your passion and for your leadership in this. We if we could clone you, we would.
Oh, thank you.
But we have in my community of activists, we have really worked hard to get candidates for Congress to grab hold of Social Security along with Medicare for all. And there's just platitudes. They just say, "Oh, I support that." But nobody will make it a platform issue. They won't take the time to actually learn what they need to know to field the questions and to sell themselves on it. It's frustrating. So have you got
You're
any?
telling me.
Yeah,
We're in the same place.
you got some advice for us on? Other than kicking them in the butt, which
Yeah.
I would like to do, but how do we move the needle with them?
Yeah, it's tenacity and annoyingness, right? Annoyingness is one of our greatest powers as activists. Don't waver on whether we're right or not ever, right? So we just have to get in there and keep pushing. And then at some point, and I will end because I know I'm eating into somebody else's time. At some point, you'll have to bite your tongue when the politician that was fighting you at a point turns around and is like, "Hey, Alex, you should hear about this great idea I have. It's an out-of-pocket cap in traditional Medicare." And you're like, "That's my idea." But instead, when Ron Wyden's staff said that to me, I was like, "That's a really great idea. I'm happy for your idea," right? So it sometimes seems like we're spinning our wheels, but I'm telling you, we're not. I will just say the one and remind everyone of something. So I wrote the bill for Ilhan Omar that canceled all student debt. And it was I actually wrote it for Keith Ellison and then moved it over for Ilhan Omar and then got Bernie Sanders in on it. And we fought with the establishment so hard on that one, right? Like, "Oh, you can't do it. It's not impossible." And then I was later in the White House with the same people who fought me, and they were arguing to me how Joe Biden canceling all student debt was a really great idea of his. And I was like, it's a really great idea of his, right? And remember, he did do it. And then the Supreme Court overturned it because, right, like, oh, Joe Biden can't do things that help non-billionaires, but Donald Trump can do anything he wants to help billionaires. And, that's why it's from the wreckage where we are, we just have to keep pushing forward. And, candidates, I will say, make it obvious to them that there's only one choice for them to make. And then the grace to show, I will say, because this is totally tactically true. Oftentimes, if you're dealing with staffers, they're very young and they just don't fully believe in that Social Security and Medicare are as relevant as they are. So come armed with public opinion polling from their favorite pollster showing, and we can help always get that. Because oftentimes they have their own issues that they think are more important. And if you can really show them because every politician, this is my Cassandra's curse, is every Democratic politician remembers that Social Security and Medicare are their path to victory right around October. And that's when they come to us and they're like, "Hey, did you know that these are really popular?" And I'm like, "I've been telling you since January, man. I really wish you'd at least taken it up in the summer." So again, it's tenacity and annoyingness, right? Just staying in there, and knowing that even if it doesn't feel at the moment like we're making that much progress, we are. And at someday we'll have to just bite our tongue while the same person that we argued with to do something is telling us about their great idea, which is actually ours.
Alex Lawson, you are my hero. Thank you for spending some time tonight with Minnesotans and sharing all this really good stuff with us. Really appreciate you, brother, and look forward to continue this work. And I've already gotten requests to get you back here at some point in time in the
Hooray.
future. So
Y'all are the best. I'm going to leave you with one last thing, which is takedownthename.org is a live stream and campaign that I'm running that should give you great joy. And it's probably coming down tonight or tomorrow. The Trump name is coming off the Kennedy Center. And we have a live stream there watching it, so you can watch it.
awesome, awesome. Thank you so
Thank you
much,
all.
Alex.
Maybe we'll give
Take
you
care.
your own show, Alex.
Hey, just so everyone knows, if you want more of Alex, he is literally going to be hosting the Tom Hartman show, I think 8 times this month, because he's does such a great job. He's good friends with Tom, and I think he's getting set up to take that darn show over. But if you want to hear more from Alex, tune in to Tom Hartman a couple of times this month. But I'll turn it over to you, Ann, and we'll get back on schedule.
Okay, Glenn, did you have something you need to ask
Oh,
before we move
sorry, I just saw that.
to our next speaker, to Rose? No? Okay. So Rose Roach is going to take us forward with a review of some work that we did the last quarterly meeting and then some suggestions about how to put that to work. Rose, you have slides and I'm going to defer to you.
Yes, I do. And thank you so much. Okay. Everybody who was at our March quarterly meeting, you might recall that we talked about we brainstormed ideas, right? Like, what can we do between now and like next session or now in the election to really get the patient-centered care bill and the Minnesota Health Plan kind of at the tip of the tongue of voters as well as, of course, candidates. So you gave a lot of really good ideas, threw a lot of spaghetti on the wall, good stuff. We kind of like collapsed it down a bit, came up with a few ideas that we think are very doable. So tonight I'm going to ask you to put your money where your mouth is. Okay. So let me see if I can forward on to here. So the first thing that that everybody said is we should find out if the candidates who are running, and some of them will be incumbents, some of them are brand new because we've got lots of retirements, right? In your district, whether they support the patient-centered care bill and the Minnesota Health Plan, whether they even know what it is. And if they say, "Oh, yeah, I support it," take them a button and make sure that they support it and tell them to wear that when they're out campaigning. So what I want to know from you all, and this is the way this is going to work, put the number 1 in the chat if you are willing to ask that question of the candidates in your area and see. And if you need buttons, make sure you let us know that. If they're willing to wear a button, we will get you buttons. And if you get a yes that they support, just email us at Healthcare for All Minnesota and say, "I talked to my candidate. My candidate's name is, Mary Smith, and she is on board with the Minnesota Health Plan." Because we would like to keep track of the candidates that are, supporting this work. Or even if they say, "I don't know if I support it because I'm not sure I know what it is," right? Because I got another one of these things we're going to do that will help them understand what it is. Okay. So first question is, can you just find out if the candidates in your area support the patient-centered care bill or the deprivatization of Medicaid, whatever is the easiest thing to say, and or the Minnesota Health Plan, and maybe poke them if you feel comfortable enough to actually take a button. Okay, that's number 1. Number 2. All right, so Put a number 2 in the chat. If this is something, this I will not get as many people, I understand, but one of the ideas was we should draft a letter to the gubernatorial candidates that explains the patient-centered care bill and the Minnesota Health Plan. We would love to have some help doing that and not have that always fall just on a few of us in the organization. We want to involve more people. We know we got a lot of really smart members out there that are really good with words and with drafting letters and knowing how to put all that stuff together in a political world. Would you be interested in sitting with a few of us and helping us write the letter that will go to gubernatorial candidates? We'll send it out. You don't have to do anything of that. Just help us draft the letter. And if you have an interest in that, put the number 2 with your name hopefully showing up, because we're going to save the chat so we know who's volunteering for what. But if it says something other than what your name is, please put 2 in your name so we know what it is you're willing to do, right? So if you would help us do that, that would be awesome. If we can even get a few people that have an interest in helping us with that, that'd be great. Number 3, here's one of the things that you all said that we think is really important to do. So candidate forums, if they haven't already, they are going to start to pop up, right? And the idea is, can we create, it will not be long because it can't be, but if we can create maybe 3 or 4 questions, maybe a couple on the patient-centered care bill, a couple on the MHP, that we could then turn around, have it in our toolkit for resources on our website, send it out to all of our members, and we would collaborate with PNHP on this and ask them to also send it out to their members. So any of our members that go to a candidate forum, they're going to have a checklist there and say, oh, I want to make sure because you can't ask a bunch of questions one person, right? But pick one. I don't care. Whichever one you feel most comfortable asking, go up to the microphone and ask that question. So anybody out there that is willing to help us create those 3 or 4 questions to participate in maybe one meeting to do that, that'll take us maybe an hour, hour and a half at most, put 3 in the chat, and you will be called upon to help us create the candidate question checklist. Number 4, this is something that actually it doesn't necessarily come out. We talked about a little bit in March, but really our leaders in the current legislature have said to us, you know what would be really helpful? Having a candidate training and helping candidates know what to say at the doors and on the phones and on the campaign trail, and how to answer that question that you're going to ask at a candidate forum, right? So we will take care of figuring out the curriculum for the candidate training, not asking you to do that. But what we could use is some people that really like to do data gathering and figuring out how to put data into a spreadsheet or a database or whatever you want to call it. We need a list of all the candidates, and this is Democrat, Republican. We're not asking for just Democrats, but any candidates that are running for the legislature. I'm pretty sure you can access it right on the Secretary of State's website. And we want both Senate candidates and of course both A and B districts of the House, and put that together for us so we have that information along with how do we get a hold of them? What's their email address? Because we want to be able to email them an invitation by mid to late July about a training that we're going to do specifically on how to talk about healthcare on the campaign trail in a way that highlights the patient-centered care bill and the Minnesota Health Plan. And number 5, if you would be willing to ask your county party's chair whether or not we could come and do like a healthcare forum. You want to call it a listening healthcare forum to hear how, the folks in the community are feeling about what's happening, especially if you happen to be out in a more rural area and you've got a hospital that's on the bubble and could very well be closing. How are the community members feeling about that? Whether that legislator is Democrat or Republican doesn't matter. They should hear what the community's thinking about that, and they should at least be willing to hear some solutions to that. Doesn't mean that we're going to automatically convince them of it. I get that. But they should at least put them out on the table and we should be able to discuss them with voters. So if you are willing to at least try to find out who your county party's chair is and reach out to them to see whether or not we could get either on a county party meeting that's happening between now and election day so we can talk to the party faithfuls, or are they thinking about ideas around maybe talking about healthcare in some kind of a town hall or something? And if they are, would they welcome Healthcare for All Minnesota to be one of their partners? So if you're willing to make that outreach, 5 goes into the chat. And the final one. So July 30th is Medicare's birthday. We all know that, right? This is a national ask. So on July 30th across this country, there are going to be people swarming congressional offices. And I'll tell you what they're going to be bringing. The first thing they're going to bring is, just like we did here in Minnesota, when we, like Don said earlier, we got over 50 organizations that signed our patient-centered care bill support letter. Well, on a national level, we got almost 350 organizations, including Healthcare for All Minnesota, and the Minnesota, and NNU is on it. I'm not sure if it's Minnesota Nurses Association with it, but I know. But PNHP is on it. All of those good organizations have signed a letter saying, doggone it, just what Alex just said, it is time for Medicare for All. No more of these half measures. We're not going to talk about public options or buy-ins or any of that kind of nonsense. It is time to work on Medicare for All. Anybody who is in a labor union and has been at a negotiating table, you know darn well that you don't go to the table with your bottom line. You are only going to get less and less and less when you do that. We are going in with the gold star because that's what we need and that's what we deserve. And if we'll probably end up doing some negotiations. We can't be total Pollyannas about that, but that's why we have to start at the gold standard, because otherwise we're going to get, as Alex said, bupkis, right? So this letter is available to all of us to take to our congressional offices. So on July 30th, and they are prioritizing and targeting Democrats in this particular part of the campaign. So what we've been asked to do is to go into our Democratic congressional rep offices and our 2 senators' offices with either a thanks or a spanks, as Jillian Mason says. And all that means is if they have signed on to the bill, Tina Smith, Betty McCollum, Ilhan Omar, we give them a thanks. We give them the letter. We give them a thanks. Tell them lots of people are behind them, and we bring a birthday cake, or we bring a birthday card, or maybe we bring some balloons or cupcakes for the staff to say we're celebrating Medicare's birthday. And we want to thank the Congresswoman, whatever, for her support, of Medicare for All, and show that lots of people are behind it. When we go into Senator Klobuchar's office or Congresswoman Morrison or Craig's office, we say, hey, guess what? There's a whole bunch of organizations in this country that are ready to fight for Medicare for All, and we want the Congresswoman to join us in that fight and to sign on to that bill. And we will still leave a cupcake or whatever it is we're going to do. But the idea is to bring attention to that this country is ready. We are ready. And these are big national organizations that signed on, along with a whole bunch of state organizations as well. So if you got a little time on July 30th, we don't have everything scheduled yet. We literally just learned about this campaign last night at this hour. And so we got to put the logistics together. But if you're willing to consider joining us on one visit, or anybody I just mentioned is one of your congressional reps, or obviously all of the senators belong to all of us, would like to go on that little quick visit, put into the chat, I'm in. And if you put I'm in, that means that you'll help us with the national ask for the July 30th Medicare for All Day of Action event. So lots for us to do, but I don't think any of it is overwhelming or anything that we can't figure out together. So hopefully this made sense, and we got some of you guys willing to help us do some of this work. Thanks everybody for your participation.
Okay, thank you, Rose. I am going to bring my slides back up if I can remember how to share. Share move to the bottom of the screen. How does it do that? And can you all see my slides?
Yep, we can see them. They're not in slide
All right. Okay.
presentation mode,
Go
but yeah,
ahead.
there you go.
Just real quick, we've got a few announcements in addition to all those other projects and suggestions. Here's some other opportunities to get involved. Upcoming events besides being on our calendar, which is the website is right at the bottom of this slide, and upcoming events will be on our calendar, and also some opportunities for outreach, which is my big thing. I'm getting out there and talking to individuals and building our base of support to build the political will for this work, and to make change inevitable. That's our job. Our job is to make this change inevitable. There is no other option, and there's no going back. I see that Jen Crawford helped by putting some of our social media sites in the chat. Bahia has put in several times ways to donate. And let me just announce that we are doing the St. Paul Pride Festival this weekend. Since June is Pride Month. This is a new event for us, June 13th and 14th, noon to 8. And it used to be downtown St. Paul. Now it's at a brewery, or a brew pub, I guess, Dual Citizen on Raymond Avenue. I didn't have a lot of time to recruit volunteers. It's open to volunteers if you are available. My phone number and email address is on the last slide, or one of the last slides in this set. And we'll send the slides out to you guys. And then Juneteenth, Friday, June 19th, I believe, is that called African American Independence Day? Am I right about that? Duluth activists are attending an event at the Central Hillside Community Center. We'll be tabling for Healthcare for All Minnesota. And then also Mankato activists for Healthcare for All Minnesota will be tabling at the Mankato Civic Center Plaza 3 to 7 on Friday, June 19th. Then one of the big events that we do is the Twin Cities Pride Festival. That's the end of the month, June 27th and 28th in Loring Park. Volunteers are needed. Please check your inbox. You probably already got a couple of requests to volunteer if you can. It's also been in our newsletters. And this is an invitation for you to volunteer if you are available. 4-hour shifts, morning or afternoon each day. And I need a little help for setup and tear down also. Then, of course, keep the Minnesota State Fair on your radar. We're just beginning the summer, but that feels a long way off. But we will start recruiting volunteers for the Great Minnesota Get Together probably mid-July, because we staff a booth in the education building 12 hours a day for 12 days of the state fair. So look for that opportunity. Also, let us know of local events that we should promote and help with turnout or tabling to organize. And of course, we are hoping for some candidate events where we can be available to give information and build our base of support. And also, candidates and office holders will tell you that healthcare is not their specialty. All of us, the more we know and the more we can do to give good information, the more we will be seen as good faith resources on this issue. Let Healthcare for All Minnesota and Physicians for a National Health Program Minnesota know of speaker requests. Anytime we can get out and give talks, we have several people who are willing to and able to give talks, either in person or virtual events. Again, the calendar is on our website, and then check our newsletter. Also, we put a lot of events in our newsletter, and things do come up in between these kinds of meetings and in between newsletters. So pay attention to emails that you get in the meantime. I said we need your help to spread our message. Jen put our social media sites in the chat. If you are not already following, please follow us on Facebook, Instagram. We could use more subscribers to our YouTube channel, a lot more subscribers. And Healthcare for All Minnesota is on Blue Sky as well. Please invite others to join this movement and help create buzz on this issue. And again, I usually include this and it'll just be in your slides when you get the slides post meeting. But these are all great websites for you to for information. And you'll see that Social Security Works is on this list. Please go to Social Security Works, also Public Citizen, also Labor Campaign for Single Payer. Rose is the executive director, our national coordinator for the Labor Campaign for Single Payer. All really important and super good information on healthcare uncovered. So pay attention to those. And Bahia, let me turn it over to you to talk a little bit about fundraising to help raise money to do our work.
Absolutely. Thank you so much, Anne. Give me just a second. Perfect. Well, hi again, everybody. Bahia Manasra here. Thank you again for tuning in and staying with us. I know we're towards the end, so I promise to make this quick. So HCAM relies heavily on donations, donors, small-time donors, big-time donors, one-time donors to help get the work done through our advocacy efforts, our educational efforts, our awareness efforts, etc., and to make sure that we're running HCAM as smoothly and sustainably as possible. And so the first thing I want to talk about is our sustaining donor program. So several months ago, we decided to launch through our fundraising committee an initiative to help grow our monthly sustaining donors. And so you yourself may have gotten a call from us. If you haven't, you may be on our future list to reach out to. Essentially, the sustaining donor program consists of our fundraising committee dedicating time each month to reach out to HCAM members, to reach out to past donors, and to reach out to folks that are interested in this movement to ask them to help sustain our efforts. And the monthly donations could be as little as $5 a month. They could be as much as however much you would like to generously give. And so I know I've been dropping the donation link in the chat. I will include it once more. Again, you are welcome to give as much as you're able to. Even if you can't become a monthly sustaining donor, you do have the option to select the box and just be a one-time donor. That's perfectly acceptable. We accept any amount from any person who believes in our mission of achieving a single payer health program for all Minnesotans. And so please take a look at the chat for that link. And we welcome, again, all donors of any amount. And then I also want to mention, if you have people in your personal or professional networks that are also interested in this work, please share the donation link with them. We welcome you to share this with anybody you think would be interested in giving and supporting the efforts of Healthcare for All Minnesota. So thank you.
If you got the invitation to this meeting this evening from somebody else and not from Healthcare for All Minnesota, please go to the website, which is right here on the screen, it was on a previous screen, and put your contact information into our Join Us page. It would be hca-mn.org. And this is what the donation page looks like if you want to go to that one on our website also. This is my contact information. Anytime you want to contact me or if you'd like to volunteer for some event coming up, go ahead and give me a call or email. And thanks again for joining us this evening for what I hope was a very interesting and productive meeting. It's time to say hello to summer. I sincerely hope that you can find time to enjoy the summer. I should have probably had a fishing pole on the screen, but I don't fish. So this is the one that appealed to me. And thank you all for attending. Anything else from our
And
presenter?
thanks for volunteering, everyone. We'll be in touch soon. Thank
Yes,
you.
Thank you. Have a great weekend ahead. Enjoy your summer and be on the lookout for more updates from Healthcare for All Minnesota.
Thanks,
Thank you,
everyone.
everybody.
Bye.
We appreciate you
And
all.
so
Thank you.
much. Bye.
And our presenters stay on for 1 minute.
Yeah, that's no problem. We still have some folks on, so we'll give it a few more seconds.